Episode 86 of the Saudi Fitness Talk Show. And today we're joined by Dr. Rudy here at the Xenos Health Summit. So thanks a lot for taking the time out. You got a busy schedule, I know. So thanks a lot for talking to us. But not just us. You're talking to everyone who's listening on the show around the world. So really appreciate it.
It's a pleasure when you reached out and you're like, would you like to come and talk? I listen to your podcast and I see what you guys are doing. I'm very impressed with what you're doing.
Thanks. Yeah, thanks. We're trying to be the shop window and help all those who are in the kingdom, but also outside the kingdom, and see what's going on. The people who are coming to Saudi Arabia, and all the great minds like yourself who are coming to Saudi and talking and sharing their knowledge and experience with everyone. I want to showcase that Saudis, there's a lot going on here. There's a lot happening. It's it was a bit of a closed book 7-8 years ago, but now it's with all the sports, with all the summits that are happening here. It's the place to be.
Yeah. So. And I'm going to tell you my ignorance. So when they told me Xenos Health Summit was coming, in my mind we're going to Dubai.
Yeah.
Because I've never come to this part of the world.
Yep.
So the only thing I know is Dubai.
Yeah.
They're like, no, it's Saudi Arabia. I'm like, oh, let me pull my geography. Let me learn more about this. Yeah. And I was like, wow, it's fascinating.
Yeah.
And I'm so glad we came here. So I flew into Doha. Then I came to Riyadh, and I'm seeing how Riyadh is not at all what I was expecting.
No, it's a beast.
Open, great, and the connection is amazing. And one thing I've learned, and I'll start with this, I got inspired. I heard here, the West is good at optimization.
Right.
The East is good at mindfulness. The Arab world is good at connection.
Yeah, interesting. Yeah,
and I feel the connection here. The people, everybody I talk to, from the workers in the hotel to everybody, it's just been amazing. And I know that for the Arab world, actually, Dr. Walid, who spoke first, he said that.
He's my client. He used to be my client.
Really?
Yeah.
I'm going to tell you, he is, to me, the most amazing speaker I've
He's
heard.
Awesome, isn't he?
So, Dr. Walid, if you're listening, I would like to connect with
Dr.
you.
Walid. I coached him for a couple of years.
Yes.
So he's a great guy, isn't he? Motivation. Talking about some of the motivation. He's got his books. He made me read his books. But his books, The Ego, and all these other books
Really?
he's done.
Please make an introduction.
Okay, if he's here, if we see him after this, I'll try and catch him. Yeah.
And I'm going to tell you why he attracts me, because he is a scientist. He's an MD who practices science-based medicine, evidence-based medicine. But at the same time, he talks about compassion, empathy, the physician touch, the human connection. So he's the one that made me realize that sometimes as physicians, healers, we forget our connection, our touch to the patient.
Yeah, I think we kind of talked about it before, but I mean, this is, the world is going so digital, it's going so fast with AI and everything else. And it's so easy now, and it will be even more so in the future, just to lose that connection with your patients. Because the easy route is just the AI can do everything. They'll read the reports, they can send them everything on an app.
AI can do this.
It can do it. And this is, but there's a difference though, sitting with someone in person. There's a different energy, different feeling compared to, just an app showing you, okay, these are my blood panels or whatever else. Someone to explain it to you, go through it.
And like Dr. Walid was saying, and that's the way I practice, not just explaining to you, be present while they're doing it, looking at you in the eye. If the patient's comfortable, a little touch. Sometimes the physician is like this. In the US, we have that problem because the physicians have to document on their electronic health record.
Okay.
They never look at the patient. So the
they're
patient is
busy
in the
typing
room,
the whole time.
busy typing, not present. So the presence of the healer has been, for indigenous populations, we're losing that touch. Dr. Walid reminded us, that's how I practice, but that was a reminder again that this is part of the most important part of healing.
Yeah, try not to disconnect, especially as the world is making it more, easier and easier and faster and faster, and everything can be automated and everything like that. But
which we embrace.
Yes.
Right? We embrace that. So I look at what AI is doing in my life. It's making a lot of the mundane tasks, the easy tasks, I delegate to AI.
Yeah.
But I will never delegate my human touch.
Yeah.
My healing touch to AI.
Yeah, good. And so we want to delve into, from what you're known for is the GLP-1's and testosterone and that side of things. And obviously, here from, I've been living and working here for 7 years, and GLP-1's the last 2 years has really taken off. A lot of people talking about it, asking questions about it, using it. getting a lot of success with it, some not having some success with it. So we really wanted to open this can of worms with you and find out, from someone like yourself about GLP-1s more, and then also to educate the audience about it.
Definitely. And if you don't mind, I'm going to go back with my journey, how I got to where I am, right?
Yeah.
I'm originally from Haiti, and I went to Miami in 1990 when I was 21 years old to pursue my medical career. Eventually, I did my nutrition degree, which doctors usually don't get any nutrition schooling during their 4 years of med school.
No.
I did my bachelor's degree in nutrition, food science, not knowing I was going to eventually go into metabolic and medicine. So I did internal medicine at Miami, University of Miami. Then I worked as what we call a hospitalist. So that means I worked in the hospital only, and I saw all the sick patients.
Okay.
ICU, emergency room, anybody who's heart attack, code blue, that was me. I worked 12 years like this, hundreds of hours, tired, exhausted. I loved what I did.
Yeah.
I was really good at what I did, but it didn't fulfill me after a while, and I was burning out. I didn't no longer want to treat disease. I wanted to prevent disease. So that's when in 2005 I started going to rejuvenation clinic, and I learned how to do weight loss.
Okay.
Because again, my background in nutrition. 2005 I opened a weight loss clinic, started doing weight loss because obesity is a crisis everywhere.
Yep.
We're going to talk about the obesity crisis in the Gulf countries.
Yeah.
But in the US, about 2/3, more than 60% of patients are either overweight or obese. That's a huge number. And obesity goes back to lifestyle, right? And mostly what we eat. So nutrition is the lowest hanging fruit of wellness.
Yeah.
So when I opened my weight loss clinic, I'm like, let me educate my patients on nutrition. And of course, I had to use some appetite suppressants because most people who come to a weight loss clinic know what they should eat.
Yeah.
They just cannot do it consistently. They have cravings. So I used back then all of the FDA-approved appetite suppressants that were mostly stimulants in nature. Phentermine, phendimetrazine. They worked.
Yeah.
They were okay. But patients were going into yo-yo. Soon as you stop it, you regain the weight. They had more side effects. But that's all I had until GLP-1 came out.
So when did it come out, though, GLP? When was the first?
Here's the other interesting thing. GLP-1 medication were first FDA approved in 2005. So it's 20 years of experience.
Wow.
Very few people and very few clinicians know about this. I've been using GLP-1 in my patients since 2005. So GLP-1. So now let's jump into it. Because again, when you look at my journey, I started using the stimulant type medications and I wasn't satisfied. The same way I wasn't satisfied with my acute care medicine, I felt it wasn't the right thing. When GLP-1 came, and it could really help people to lose weight, and for a lot of them, keep the weight off and help them deal with cravings, it was a paradigm shift. And obesity medicine needed a paradigm shift, not the stimulant type medications.
Okay.
So now let's trace back the history of GLP-1 medication.
Yeah.
So GLP-1, there are a class of hormones called incretin hormones that are secreted by the gut in the intestines, and that do many things, including digestion. So GLP-1 is when you eat something by mouth, your body will will make GLP-1 so you can increase your insulin production.
Right.
And be able to digest the blood sugar.
Okay.
And then once it does that, it slows down your digestion. So we make that naturally. Interestingly enough, from the 1980s, scientists discovered that in the saliva of this lizard that lives in the desert in the United States. And they saw that lizard can only sometimes eat once a year and be okay. And they found they had that GLP-1 in there. And they started playing with it. They said it had something with insulin. So they played with it for 20 years. 2005, the first GLP-1 medication was FDA approved for the treatment of diabetes.
Okay.
It was called exenatide.
Yep.
I used it since that time. And it was a miracle for diabetes. Miracle. Because for diabetes, type 2 diabetes.
Yeah, type 2,
patients who are taking, they eat too much, insulin resistance, they get overweight, eventually they need to use insulin. Insulin is a bad treatment for diabetes because insulin causes you to gain more weight, get more visceral fat. So we had to use it. That's the only thing we had.
Yeah.
Before we had the metformin, the sulfonylureas type of things.
Yeah.
So when I started using GLP-1 medication, within 6 months, I would see the hemoglobin A1C, the average blood sugar over 3 months, decrease, go back to normal. I was like, what is this medication? It's because it addressed insulin resistance at its core, in the cellular level.
Okay.
So this first generation called exenatide did nothing for weight loss. It was purely for diabetes because for some reason, this one did not cause a decrease in appetite.
Yeah.
So it's, again, GLP-1 another diabetes medication. It's a gut hormone that happens to help with blood sugar metabolism. So now, keep going. 2014, the first GLP-1 became FDA approved for weight loss. It was called liraglutide, Saxenda. This one did decent on weight loss. I used a good amount of it. Patient would lose maybe 8 pounds, 10 pounds, 15 pounds if they were lucky.
Yeah.
Diabetes would get really well, but it got FDA approval in the US for weight loss even if you didn't have diabetes.
Okay.
But it wasn't great.
Yeah.
I didn't use a lot of it because it wasn't great.
Yeah.
Then in 2017, Ozempic, semaglutide came out. I don't know what they did to that molecule. They made it last longer. It was able to cross the blood-brain barrier, so it really affected cravings.
Right.
And that's the GLP-1 everybody knows about.
Right.
Kim Kardashian talked about Ozempic.
Yeah.
It was mentioned at every Oscar because really when somebody takes that, your appetite, your cravings, what they call food noise, goes away. Goes away. So this is when I realized this was the paradigm shift that we needed. Because when you're able to take away the food noise from those patients, they can now follow the advice of the doctor, the dietitian, the advice that they know. Most people who gain weight, it's not that they don't know that they should be eating like this. They can't help it.
Yeah.
And that's when I realized that obesity, it's not a question of a lack of a willpower. It's a hormonal imbalance.
Yeah.
GLP-1 is a hormone. We didn't know about GLP-1 until 20 years ago. So relatively, it's pretty new. But it's not 5 years old.
Yeah, it's been well tested.
People think it's
tried
2
and
years,
tested
5
and
years.
modified
And what's important for me, why I like to say this, because are there side effects? Yes, there are also short-term side effects to GLP, which we're going to cover. But the way you know if a medication is safe, it's not if it's FDA approved. Right. There's been many medications that were FDA approved that were recalled.
Yeah.
Once millions of people take it. The way you know a medication is safe, it's once you have, I usually wait 10 years that it gets on the market. Okay. Millions of people take it. And if you don't see that there's a high incidence of those side effects, then you know it's pretty safe. So we have 20-year track record of GLP-1 medication. They've never been recalled. They've never shown to show anything bad long term. In the opposite, they're showing so much other benefits beyond weight loss. Let me throw a few benefits that they get. They got FDA approved to decrease cardiovascular disease, heart attacks, cardiovascular death, and overall mortality in diabetics and non-diabetic patients. They've been FDA approved to remove fat from your liver, fatty liver, prevent progression of kidney disease. FDA approved for sleep apnea.
Yeah.
Not just because you lose weight, because you decrease inflammation. They've shown now in studies that they don't have it's not FDA approved, but they're showing long-term studies that it decreases the incidence of Alzheimer's dementia.
Because people call that the type 3 diabetes, don't they?
Type 3 diabetes, really good. So almost a 40 to 70% decrease in Alzheimer's dementia. They've shown that it decreased 10 out of 13 incidents of obesity-related cancers. Things like pancreatic cancer, colon cancer, esophageal cancer. So when you think about one medication doing all this, it almost sounds like too good to be true.
Well, yeah, that's what I was going to say.
It almost sounds like it's an infomercial.
Yeah.
Oh, it can do this, it can do that. Why? Because it addresses insulin resistance.
Which affects everything.
Yeah. Everything. It's at the base of almost every chronic disease.
Yeah,
and it decreases inflammation.
Yeah.
Most people who take GLP-1 will tell you they have less aches and pains.
Yeah.
Their body doesn't work. They feel less bloated.
What about the muscle? Because a lot of people say I heard one thing saying, when you do normal weight loss, for instance, 2/3 of the weight you lose is fat, 1/3 is muscle. Whereas with GLP-1s, it's the reverse. 2/3 of it is lean body mass or muscle mass, and then the third, is that true? Or
so not exact numbers like this. So when you look at the studies, it's about 25% of your weight loss can come from muscle.
Okay.
They've cited even up to 40%, but most of the studies are showing about 25%.
Right.
There's no weight loss that happens without muscle loss. Right?
With the natural.
That always. And what I see with my patients, if you're just losing 20 pounds, you don't lose that much muscle.
Yeah.
So the patient will lose 50, 60, 100 pounds.
But sometimes they need to because, when you are, say, 150 kilos or 300 odd pounds, like your body puts on muscle to keep you
Support,
moving,
yeah.
Support a lot of it, doesn't
but
it?
not really.
No?
Even people at that heavy weight,
Yeah.
they are heavy with fat,
Yeah.
but they have sarcopenia, low muscle mass. So it is a problem.
My dad I think he's got both. He's got too much weight and too much.
So that's the one thing I don't like
Yeah.
with GLP-1s, that because they are so effective at weight loss that you can have muscle loss. But we can mitigate this.
Yeah.
Right? We're not going to throw the baby away with the bathwater. So what I tell my patients from day one, when they're going to start GLP-1 medication, make sure you eat enough protein.
Yep.
Make sure you do resistance training, not just go walking and do cardio.
Yeah.
And then, but here's something that's really interesting, because those patients who need to lose weight, they've heard that their whole life. You need to exercise, you need to eat enough protein. But they're almost so deep into, I can't lose weight. I always lose in that battle.
Yeah. They yo-yo, they lose it, they gain
so
it,
they
lose it.
The psychological aspect of it.
The psychological aspect is huge, because they've internalized, I can't lose weight.
Yeah, I can't.
Right?
I've tried for years, decades, and I
So
can't
it's
do
a
it.
defeating type of attitude. With GLP-1, you get results, and results beget results. So you'll see that a patient will come to me, and usually I'm the doctor in Miami, that they send the non-compliant patients. Right? The one that the doctor kept telling, you need to lose weight. They keep gaining. They don't follow what they're supposed to.
Right.
They come to me. You don't need to deserve to take a GLP-1 medication.
Okay.
Because there's something that, am I a candidate for it? If you're trying to lose weight, you're a candidate for it. Why? Even if you didn't change your habits yet, because you lose the first 5 pounds, you lose the first 10 pounds, your food noise is gone. All of a sudden, that non-compliant patient now wants to go to the gym. Now wants to eat a salad.
Because they can actually move now, and they're lighter. It's easier to move. Yeah.
But more than easier to move, they're winning.
Yeah,
They
positive.
finally feel like, oh my God, I'm not always thinking about food and I'm dieting. I lost the first 10 pounds. Those first 10 pounds makes them see it can happen.
I really want to get my parents to do it, and because they're both overweight, but they get similar thing. But they're like, oh no, they just need to take that first step.
First step.
My dad is
they
actually
can't.
using Mounjaro.
Yeah, he
My
is,
dad's
isn't
he's smashing it. He's losing so much
he's lost
weight.
a lot of weight.
Loads of weight.
And Mounjaro is the best one.
Yeah.
So again, going to the progression of GLP-1,
Yeah.
semaglutide, which is Ozempic or Wegovy, came out in 2017, 2018.
Yeah.
That was a GLP-1.
Okay.
Then Mounjaro, tirzepatide, came out in 2021.
Right.
That was an advancement, because on this medication, the first time they targeted another receptor called the GIP.
Yeah.
So it's GLP-1 plus GIP. And it is completely superior to Ozempic. More weight loss, less side effects, more visceral adipose tissue, belly fat.
Great, yeah.
You tend to lose a lot more with this. So Mounjaro, tell your dad he's doing
He's
good.
doing the right thing.
Right?
Yeah.
He's doing the right
Keep
thing.
going,
The only
Dad.
thing,
Yeah.
is he lifting weights?
No.
Pint.
He's lifting
Is
beer.
does that
Lifting
count?
beer.
Bit of golf. He's playing golf.
Playing
So,
golf.
but tell him you spoke to a doctor who's a specialist in this.
He has to watch
First,
this
I'll
that-
tell him
episode.
listen to this episode.
listen to
I'll
this.
send it to him.
First, congratulations. Give yourself a pat on the back.
Yeah.
This is not cheating, because a lot of people will shame people like your dad.
Yeah.
Who like, oh, you couldn't do it on your own. You had to cheat. And do
Yeah,
this.
you're weak
Well,
and all
you know
this,
what?
yeah.
If it's cheating, you're cheating for health.
Yeah.
And we realize that. How long has your dad been trying to lose weight?
Oof, he's been doing it back and forth for 25 years,
Right?
probably.
Do
Yeah.
you think he didn't know? Like, he shouldn't be eating the stuff.
He knows
was
what to
eating?
do.
He knows.
He just doesn't.
What do you know what Mounjaro did for him? It took away that cravings. It took away that food addiction. We have to call it as it is. It is a food addiction. And we're all guilty. I'm guilty.
Yeah.
I'm lucky because I work out a lot, and I know I'm an 80-20 guy. Right?
Yeah.
80% of the time I
Yeah,
eat
same.
well.
Yeah, we all are,
But
yeah.
I give in to my food addiction.
Yeah.
The food nowadays, the processed foods, and especially in the US, the UK, it's processed foods that have been engineered to make us addicted. So it's not a fair fight. We're asking somebody to, it's like you're asking somebody who's addicted to cocaine to just stop.
Yeah.
I have two things. What's some good Haitian food that's addictive, and what's
Is that the weak point? Yeah.
that's our national dish is called griot.
Okay.
And it's fried pork. That's
Whoa,
marinated
let's
in
go.
all those
pork
oranges
belly,
that they
yeah,
make on
pork
the
belly,
the
yeah,
whole- Oh my God, that is the best.
Yeah.
The best. So that's my weakness. And
Yeah.
we eat a lot of rice, a lot of plantains,
Beans,
a lot of carbs.
Yeah.
So man, you put me in front of some Haitian food. Man,
yeah,
I'ma tell you,
double carbs is always good.
Double
Plantain
carbs.
and
Plantain,
rice.
rice, and beans. You've got to just
all of
triple
it.
whammy,
all of it together.
Yeah.
So you know,
Yeah.
so GLP-1 has made us realize that people like your dad weren't weak. They weren't flawed. They just didn't get the right tools. Right? Because he's been dealing with it for 20 years. How come a hormone made him change? Because it took away his cravings. It took away his food addiction and his dependence on the foods. It wasn't a lack of education. So what GLP-1 is, it increases your motivation. And it fixes your biology. I'm big on biology, right? So when somebody has a lack of motivation, I always say that to myself, and I have the patient think this. Is it a lack of motivation, or is it a biological imbalance? Most times it is. Your dad's case, and I'm so glad we're talking about it. It was his biology was not aligned. He needed a hormone to help him get better. And then now tell me if it's true. Now that he's losing weight, do you see that his behavior is changing?
Yeah, of course. He's getting up in the morning. He's moving around. He's doing stuff. Yeah, much better.
My God.
Yeah.
Thank you, sir, for being part of the podcast.
That's what I want my parents. They just can't.
Yeah.
Now that they're in, so big, for so long, their joints hurt. They can't.
Yes.
They
Obesity
just can't.
sucks, man.
Yeah, they can't do much.
Obesity sucks, and then you think about
they can't play with their grandkids. They can't.
It sucks, and it's not that the people suffering from this don't want to help themselves. They can't. There's a neurobiological dysfunction in the brain. There's an addiction. It's the reward pathways that are being hijacked by those foods. So interestingly enough, and I don't know if your dad noticed that, most people who take GLP-1 medications don't want to drink as much.
He said, it's true. I told Adam that when I came back.
So it's an addiction medication.
Yeah.
It's not just a diabetes or weight loss.
Interesting.
Because what it does, it goes into the brain. That's why it's only when it got to the Ozempic that crossed the blood-brain barriers, because we have GLP-1 receptors in the brain. And then the dopamine hits that we get with alcohol, with food.
Yeah, sugar and everything.
I went for dinner with him. He had one beer. I was like, what's happening?
Especially in England,
the liquor industry hates those medications.
I bet they do, don't they?
Yeah.
Because people are drinking less.
You usually have, 4 or 5?
It's ridiculous. Yeah.
He has one.
And again, before, do you think he didn't know that he shouldn't drink 4 or 5 beers?
Of course.
It tasted good. He wanted more.
Yeah.
So with the medication, you don't have to tell him. He does it because his brain works better now. So again, you said something interesting before we started this. What about patients who just need to lose 3 kilos? 4 kilos?
There's
a lot of that
Should
here.
they think that?
Yeah.
It's a hell yes for me.
Yeah.
It's a hell yes.
Why is that? Yeah.
Even 3 to 4 kilos, if it's in the belly fat, that's visceral adipose tissue, it increases your inflammation. It increases your risk of heart disease. It increases your risk of insulin resistance and diabetes. So, of course, even your dad, I always tell my patients, it's not just take that shot and goodbye. Let's make sure you at least do the pillars of health. You improve your nutrition. You eat enough protein. You exercise. You do.
Well, that's what I was going to say. Yeah, sleep.
Right? You need to do all this.
Yeah.
Sleep. Those are my 3 pillars. So somebody who needs to lose 3 kilos, usually they've tried already a lot of things. Those are usually women. We see that a lot, especially if they're going to perimenopause. They're late 30s, 40 years old. Their metabolism changes. You see that they start gaining weight. They can't lose the weight. So why am I going to wait for that patient to now need to lose 20 kilos? And that's when I'm going to say, now you can use it.
Well, what if someone's like, they're just pure lazy? They're like, I don't want to change any of my habits. I just want to take that. How do you deal with those type of patients?
So again, that's the judgment that we put a lot. And there are lazy people. There's no question. But a lot of time laziness comes because the patient has always been losing. Yeah. So when you empower the patient into getting results, you'll be surprised to see how not lazy they are. Your dad is a perfect example. He never got up and go to walk before. He started losing weight. He feels better.
Started walking
He feels
more.
like he's winning. It's not just that he feels
It's
like
like a knock-on effect.
It's so I always say that we usually our behavior is in spiral. When you overweight, even if you're only you need to lose 4 kilos, you feel like you're in a downward spiral. I don't feel good. I'm not losing weight.
But the GLP can help with an upward spiral.
It's an upward spiral. So we can change that behavior. So laziness has taken a different perspective for me. Free will, it's a different perspective. Can you choose not to eat when you have a food addiction? GLP-1 treat food addiction, treat alcohol addiction. So we need to look at GLP-1 as an addiction medication that happens to help you lose weight. and happens to improve your diabetes.
Yeah, it's definitely. One of my mentor, Charles Poliquin, I don't know if you know him, but he Canadian guy, and he always talked about with nutrition is focusing on brain nutrition first. Get the brain healthy so that people can actually think right and make the right decisions, satisfy all those cravings. So that's why like the high protein and trying to, having his big thing was like meat and nuts in the morning. Yeah. So then you would have high fat, high protein, and then you would make better decisions. Yes. You wouldn't have the cravings. You're more satiated. Blah blah blah. Blah. Because he said I always would focus on like omega-3s. So you focus on brain health first. Get the brain and the gut healthy, and then that leads to all the other things. Because otherwise you just can't think. When you have the brain fog and all the messages.
Inflammation. It's all the bad foods. It's too much carb, too much sugar. Sugar is the worst toxin. But the issue is, in my nutrition education 30 years ago, your mentor, like all the amazing speakers that we've had here today, at Xenos, we all say the same. Yeah. Focus on protein, more good fats, eat whole foods, avoid processed foods, avoid sugar.
Same message.
For some people, they're able to do it. I'm able to do it. I'm lucky. And I don't know what it is, but some people can't.
Yeah.
And some people, we can call them lazy, we can call them weak. Mm-hmm. You give them a GLP-1 and they're no longer lazy, no longer weak.
Yeah.
So this is when you realize weakness and laziness, there's a biological component to it.
Yeah.
And we're going to talk about testosterone, for example.
Yeah.
I'm on testosterone therapy.
Yeah.
Right? When I developed low T at the age of 49, I became lazy. So I thought that our disposition, our mental disposition was set in stone.
Yeah.
I've never been a lazy person.
Yeah.
I always had 6 jobs. I work 100 hours.
Yeah.
I had low T at 49. I still worked hard, but I would maybe 50% less productive. My brain didn't work the same. Okay. So I could have called myself lazy compared to how I used to be.
Yeah, true.
I went on testosterone. I'm back to how I was. So it wasn't a lack of motivation. It was a hormonal imbalance.
And I heard you talking about this new form, the oral form of testosterone, which is
amazing.
Really, really cool. Maybe you can expand more on that because everyone is put off with the injectables and everything else.
So let's talk about testosterone for a little bit.
Let's go through
and then let's touch onto the muscle loss that can happen with GLP-1. It is real. I'm not going to try to sugarcoat it. It's because they're so effective that you can lose a good amount of muscle. And I think everybody has seen some of those patients who've lost weight due to GLP-1 who look gaunt.
Yeah.
Who look like
the face.
You see their little arms. You see that. We don't want to get there because studies show that muscle mass is the organ of longevity.
Yep.
Decreases inflammation, decreases mortality. One of the most important markers of mortality is grip strength.
Yep.
If you don't have muscle mass, you don't have grip strength. Increases frailty, increases your risk of dying.
Yep. Yeah.
So muscle mass is important. So for my patients who are on GLP-1, a lot of them who have insulin resistance, if you're overweight, obese, you have a lot of visceral adipose tissue, you most likely have some kind of hormonal testosterone insufficiency.
Yeah.
So for a lot of my patients, I check testosterone. And if testosterone is not adequate, adding testosterone to GLP-1 is another game changer. And I call the combination of GLP-1 treatment plus testosterone the closest thing to a fountain of youth we ever had. Because now you lose the body fat, you lose the inflammation, and you can build muscle with the testosterone.
I mean, we actually joked about this once, but we did say it would be the ultimate combo.
We did actually.
Remember we joked about it? Yeah.
Oh
my God.
You guys are ahead of your time.
I think so.
You,
it was a joke. Like saying, how could you get like the
joked
craziest results? How could you get the craziest, get in the best shape as fast as possible? We said GLP-1's and testosterone.
So I use that for my patients on a regular basis, and they feel amazing with this. Again, you have to check levels. You have to testosterone. You have to
do all the blood work first.
All of this. But it is, you get the fat loss and you get the muscle building at the same time. Not easy to get this. So testosterone, when indicated, to me, is amazing. Now, when you look at the forms of testosterone, I'm on testosterone injectable. That's what I like the most. I'm getting tired of injection. I've tried the creams. I didn't like it as much. But I like injection. Most of my practice, I'll say 75%, 60 to 75% of my patients are on injection. But there's a new form of oral testosterone. It's called Kyzotrex.
Yeah.
Kyzatrex. And I'm going to shout out to Kyzotrex and the CEO, Anil Shah.
Yeah.
They came up with an amazing product. It's actually FDA approved in the US. It's an oral form, a tablet, that doesn't go through the liver because testosterone usually
You said
the old forms,
lymphatic system.
It's absorbed through your lymphatics.
That's incredible.
So it doesn't affect your liver. And because you take it twice a day, it's short acting, it doesn't affect your fertility. Because one of the side effects, that's
crazy. Yeah.
One of the side effects of the long-term testosterone, the long-acting, like injectable or cream, is that it decreases your own production of testosterone. It decreases your sperm count.
Yep.
So if you
all your FST, everything just shuts down, doesn't it?
It shuts down your LH, your
luteinizing hormone.
And so it is a problem. I don't want to have kids anymore, so I don't care.
Yeah.
But now that we have younger and younger men with low T, if you start taking testosterone and you don't have kids yet, that may be an issue. It can be reversed.
Yeah.
It can be reversed. But now with Kaisertrex, it doesn't. The FDA approval was that it doesn't decrease your LH, it doesn't affect your sperm count. So if necessary, that's an option.
Yeah.
A lot of guys don't want injection. So somebody like your dad, you should tell him, go get your testosterone checked. If his testosterone is low, adding that oral testosterone, I don't know if it's available in the UK.
Yeah,
sure.
How long has it been around? It's recent,
pretty recent.
Yeah.
But that form of testosterone is called testosterone undecanoate.
Undecanoate.
The tablet, there's a few other brand names that came a few years ago.
Okay.
So I don't know the Kaisertrex, that's my favorite.
See what's in the UK,
so it'll be interesting to see if they have that. But combining that and what testosterone does, when we think testosterone, we think muscles and sex. It really helps for that. It really does.
Come on, Dad.
It goes beyond that. What it does for the brain, the neuroplasticity, the motivation. I told you, my motivation went down at 49.
Yeah.
Now, I want to open more business. I want to do more things. I want to go further. That's what testosterone does. Testosterone really helps you want to keep doing things, exploring, discovering, the drive. And we deserve, no matter what your age is, you deserve to have that drive, that motivation, that fire. I'm 55 now. In my mind, when I was growing up, I was going to retire at 55 and go and play golf. Hell no.
Yeah.
Now I'm just starting. I want to open more business, do more things, and I have the capacity to learn new things because I'm hormonally balanced.
And with like GLP-1, I mean, with all these things, how long is it till you get to a weight and then you come off it, or you go to a maintenance like dose, or you like kind of gradually come off it?
So that's a great question. So in my practice, again, I've been doing it 20 years, what I realized, right? So somebody comes to me first, you don't need to deserve to need this.
Yeah.
If you feel like you need the help, I will give it to you.
Yeah.
With the right supervision. I see the patient on a regular basis. I'll give them nutrition education, behavior modification. I see them, I get the touch with them so we can really push them to get there. Now, let's say it takes 4 months, 6 months to lose your weight. You can stop it, but what I usually do with my patients, I don't have them stop it all of a sudden.
Yeah.
I have them taper off. So they'll start taking the dose every 2 weeks. Then maybe they'll take a lower dose every 2 weeks. Then eventually they stop it. Because I want all of my patients to try.
But do they start putting on weight? Because I know people here, they see those kilos coming back on, not as much or as fast or anything, but they're like, they just freak out. They go straight back on it again.
So actually there was a study that they did with Ozempic that they've seen about 50% of people who lost their weight gained it back. First, those patients, they didn't have a doctor they were following. They just left them on their own.
Okay.
So what I see in my practice, again, we have more than 3,000 patients on active GLP-1. Usually 3 types of patients. There's the type of patients that they'll come, they'll do their GLP-1 2 months, 4 months, 6 months, whatever, lose their weight, change their habits.
All the habits,
Like they are lifting weights, they build on muscle. They never need to take it again. They never need to take it. That's 10 to 15% of my practice. Then I have the other side. Patients
10,
that
15%.
lost their weight, whenever they stop the GLP-1, within 2 to 3 weeks, all of their food noise, all of their cravings are back. They start getting swollen. They gain 10 pounds in 3 weeks. Those patients, for some reason, we don't know why, they have that inflammatory pattern, that high food addiction, they need to stay on the GLP-1.
Yeah.
10 to 15%. And I tell them, don't be ashamed that you need it. At least we found a tool that's going to keep your weight off. And what I do, I tend to microdose. I don't use the high dosing. For example, on Mounjaro, I go anywhere from 2.5 to 5 milligrams. Sometimes we microdose 1 milligram. So we go pretty low dose when necessary.
Yeah.
So for the maintenance, what I do with those patients at that extreme, that whenever they come up, they gain the weight, I'm like, okay, don't panic. Nothing is wrong with you. You just have something in your brain that needs GLP-1.
Yeah.
You don't make enough by yourself. So let's find the lowest dose, the lowest effective dose for you. We'll try a few doses. A lot of my patients, they'll take either weekly, usually 2.5, 5 milligram. And if it needs 7.5 milligram or whatever dose it takes, as long as you don't have the side effects and you're maintaining your muscle mass. The majority of my patients fall into this third category.
Yeah.
They lose their weight in 4 to 6 months. They come off
It's
the
the bell
medication.
curve, isn't it?
Yeah, exactly.
Yeah.
They lose their weight. They come off the medication. They maintain their weight within usually 3 pounds, 5 pounds. And maybe once or twice a year, they need a little boost.
Yeah.
They go on a vacation. They come back, they start eating bad. I usually tell them 10 pounds is your red line.
Yeah.
If you gain 10 pounds, come back. Don't wait till you gain everything back.
Yeah,
If you gain 10 pounds, you're doing your bad action again. You're getting that food addiction again. Your metabolism is not working.
Downward
again.
spirals coming.
Downward
Yeah,
spiral.
yeah, yeah.
Don't let it get too low.
Yeah.
But I empower patients. I tell them, because what happens with a lot of patients when they start regaining the weight, here comes the shame again. You see, I'm a loser. There I go again. And when you feel like this, what do you want to do? Eat junk.
Yeah.
Right? So they perpetuate
You're
that
just
cycle.
like, screw it. I'm just going to go.
So from
Plantain
day
and
one, I
rice.
empower
Let's
the
go.
patients.
Yeah.
If you need it for life, that's okay. If you need it once in a while, we'll see. It's very personalized.
Yeah.
Now let's go over the patient that maybe needs it for life. Is it okay? Right? Because that's the big question.
Yeah.
So some patients will be like, I don't want to take that forever. We don't know what's going to happen.
It's
Is
just
it
a
gonna
huge
cause
question.
cancer?
Yeah, everyone asks.
That's the big question people are asking. And that's when I tell people, this is not a medication that's been out 5 years. It's 20 years. So
Yeah.
we know what the long-term
So you can take it for 20 years.
I have patients. My diabetic patients
Yeah,
had
yeah.
it for 20 years.
Yeah.
Right? And they've shown long-term. I've told you all the benefits long-term. Because it decreases inflammation. You have less risk of heart disease, dying of a heart attack, less risk of heart failure, diabetes, insulin resistance, Alzheimer's dementia, Parkinson's disease, arthritis, sleep apnea.
And they're
fatty
all
liver.
kind of compounding, aren't they?
All of
Yes.
Compounding, yeah.
Because again, remember I told you that in the beginning, we need to look at GLP-1 as an anti-inflammatory peptide
Yes.
that happens to cause weight loss and diabetes control. So imagine that I had a peptide.
Because fat is pro-inflammatory.
Almost time.
You know,
yeah.
fat is very. You said
Very
it's an
inflammatory.
active
Yes,
organ.
it's
You
an
know.
active endocrine organ.
Yeah.
So the opposite is true of muscle. Muscle is an active endocrine organ, but decreases inflammation. Secretes something called myokines that decreases inflammation. So as we age, or at any time of your life, but worse as you age, you want to decrease your body fat, increase your lean muscle.
Yeah.
You'll decrease inflammation and increase your myokines.
Because for longevity, everyone, it's kind of a last kind of point really, is that when people look at longevity, they're obsessed with the cholesterol, they're obsessed with, and even a lot of GPs and doctors in the UK, they always, they're looking at the blood pressure, the cholesterol. They're never looking at sarcopenia, dyspnea, grip strength, how strong your body is, bone
important.
density, all these type of things.
But you know how many patients have taken off their cholesterol medication, their blood pressure
Yeah.
medication with GLP-1? Because again, you go back to insulin resistance and with the weight gain,
Yeah.
with the visceral adipose tissue. So I wish nobody needed GLP-1s.
Yeah.
I wish your dad, for the past 20 years, could have just ate less and lose weight. It's not realistic.
Yeah.
With
For
the
a lot of
environment that we're
people,
living in, yeah.
Yeah, the environment, the toxic environment that we live in. Food is so pervasive. Bad food is so pervasive.
So
We're addicted
easy.
to food.
On a phone,
plus.
delivered
And-
in 15 minutes.
And
Whatever.
then plus now, if we start talking, that's a whole nother talk, to talk about endocrine disrupting chemicals.
Yeah.
There's a line of chemicals, they call them obesogens.
Yeah.
They cause obesity. They make your fat cells go faster.
Yeah.
So you're exposed to a chemical and it makes you gain weight. It's not your fault. So I want to remove the guilt that people who are trying to lose weight have.
Yeah.
It's not just you. Yes, you could do better, but something's holding you back. Let's fix your biology and your psychology will improve.
Yeah, it's true, isn't it? Yeah, because it's so easy just to blame them and just say, you could be doing this, but they just can't.
Yeah.
From the psychology and the brain perspective, they just can't think it. They can't. It is just wired, and by getting those GLPs, just to even kick, if it's a kickstart or something that they do for a while.
Whichever one. But while now they're in
Yeah.
the upward spiral, that's the job of the physician, the coach, the nutritionist, to put in good information.
Yeah.
It's the job of the patient at this time to build new habits.
Yeah.
But now that they're winning, they're not addicted, they're not always thinking about food, they can lay new habits.
Yeah.
I believe in the power of the resilience of the human spirit if you remove the distractions. And again, I have a love-hate relationship with GLP-1s. I love that they are so powerful and so effective. I hate that we have to use so much of them. I wish I could just tell somebody, eat less and exercise more, and they lost weight. It's not what we're seeing in real life.
Yeah.
Yeah, I think I think that simplicity, that eat less, move more, works in simple environments. Say like there's a lot of these blue zones, and they're in Sardinia.
Yes.
Simple life. They have their house. They walk out.
Yes.
They do a bit of gardening. They have their plants. They eat it, and it's a simple life. But in the world that we're living in, it's just getting more noise, more complex, more toxic, everything else.
Yeah.
We have to, and that's what we've kind of learned, I think, probably this morning and this today, since we've done, spoken to a few of you guys, is that actually in this modern world, we actually probably do need a bit more support.
We do, and it's unfortunate. It really is.
Yeah.
I wish we didn't. I wish we could all live in a blue zone.
Yeah.
Right?
Yeah.
It's not
It'd be lovely, wouldn't it?
It'd be great. Be great. And I think why this is important, and especially for anybody in Saudi and in the Gulf countries listening to this, they need to know that there's an effective tool. As you said, it became big here.
Yeah.
We need to remove the shame and the stigma that using this, people are ashamed to say they're using it.
Yeah.
If you empower the patient to know you got a good tool, but now listen to what I'm saying. Listen to, now it's the age of information. People go on YouTube, they can see that. Please follow my podcast to get those tips.
Yeah.
Right?
Fountain of
but
Youth.
get those tips to get you there. But don't be ashamed to use those tools. They're the most effective tools that we have for the most ubiquitous epidemic that's getting us now.
Yeah.
Obesity is everywhere. It used to be a first world problem. It's everywhere now.
Yeah, it's everywhere.
So I have a pretty cool way that I like to I call GLP-1s the penicillin of our era.
Okay.
1940s.
Wow, that much? Yeah.
What was killing us in the 1940s? Infectious
Infections,
disease.
yeah.
Infection. So we needed an antibiotic. So we invented penicillin. And because of death,
And right
we're down
now,
significantly.
in the Western
What's
world,
killing us now? Diabetes, heart attacks, Alzheimer's disease.
And
What's
a lot
the
of
most
it's insulin
effective
related.
tool for that?
Yeah.
GLP-1. So GLP-1 are the penicillin of our era. Are there side effects? Yes, there are side effects. They're usually minimum. You can mitigate them. We have ways that we can get over them. Penicillin killed a lot of people when it first came out.
Yeah.
Because you can get a bad allergic reaction
Yeah,
to it.
yes.
But we didn't throw away penicillin because it had side effects.
True.
And the side effects of GLP-1 are way less compared to what happened with penicillin. So my goal and my mission is to help people embrace this new class of medications, not because I want people to rely on a medication, because I realize that it fixes an addictive problem that our society is suffering from.
Incredible. Wow, you totally opened up my eyes. I mean, because I've had one client who I worked with for a long time, and she struggled a lot, yo-yoed a lot, and then she started, I think Ozempic, and she lost 30 kilos, 40 kilos, and now she's running marathons, and she's got her life back.
Example. How long were you working with her before?
Probably about 2 years, 3 years, and she lost a bit, gained a bit, but just couldn't dial it in.
That's so typical.
Yeah.
Did she not understand your message?
Of course she did. Yeah.
Of course she did.
But she just couldn't.
She could not. So now I'm hoping that I made my point across, that it's a neurobiological dysfunction.
Yeah.
Something in your brain. We can't diagnose it. I don't have an MRI or blood test to show that.
Yeah.
But you see, she took it and it fixed it.
Yeah.
So there was
And
a
with your dad, I mean,
biological
your
fix. Your
Yeah.
dad.
For it to work with your dad as well.
Yeah,
Yes.
it's impressive.
That's impressive to work with your dad. So, but well, look, really appreciate you coming on and just opening our eyes. You've opened my eyes a lot. It just made it a lot clearer, because I had a lot of doubts and a lot of questions, and I wasn't sure, and and it cleared up a lot of things. So it's great to hear from an expert like yourself, someone who's been doing it for a long time. It's 20 odd years. So
And you know what's even more confusing to patients? They're hearing other experts who are saying it's bad for you. A lot of functional medicine.
there's not a
doctors
lot
are
of great
saying
press. Yeah.
There's a lot of bad press. There's actually in the US now a lawsuit against the makers of Ozempic, because the lawyers know, because they're making money, they're trying to capitalize.
Trying to just
So the patient is
Yeah.
confused. They're seeing their friends, their family members lose weight. They're like, should I take that? I'm actually writing a book.
Okay.
Should I take Ozempic, doc?
Oh, great title.
Nice.
Straight to the
Straight to
question.
the point,
Everybody's asking this.
Yeah.
Everybody's confused. They're saying, should I? I heard Dr. So-and-so say that it's going to give me this.
And I
I
saw this
heard there's a
article say
lawsuit.
this, and my friend said that. And,
Exactly. And again, if you can do it without, more power to you.
yeah.
I'm proud of you. Congratulations. Keep doing it. But if you're struggling, don't be ashamed. Don't be scared. Find an expert who can really guide you through this.
Yeah.
But get onto that upward spiral.
Yeah, it's not easy just to, I'm just going to just drop 5 of my best friends. It's the average of the 5 people we spend the most time with. It's like, I'm just going to get rid of 5 of my best friends. It's like, it's not easy as that.
Easy.
Yeah, or I'm going to quit my job, or I'm going to get rid of my wife because she's a bad influence. You know what I mean? It's not easy just to do that. But if you can start something and get that trajectory and lead the way with your family, with your friends, whatever,
100%.
they might follow you.
Yeah, they most likely will follow.
Yeah.
So now you become the catalyst
Exactly.
for change. Your dad, again, is the example.
Yeah.
He didn't change his friends, he didn't change anything. Now he still goes to the pub, he has one beer.
Yeah.
And
Different.
really, that's going to be the next FDA approval. Majority of my patients on GLP-1 decrease their drinking by 50 to 75%, or a lot of them even quit.
Yeah.
They're just like, I don't feel like it.
Yeah.
I didn't ask them to quit. They're just like, I don't feel like it. Again, the reward pathways. I love seeing your
Yeah,
you guys
Just
are like,
thinking. Yeah.
No, look, Dr. Rudy, where can people keep following you, find you? Obviously, it sounds like you got a book coming out.
Yes.
Please
yes.
share away.
So my social media is Dr. Rudy Best Life, Dr. Rudy Best Life. I have a podcast, The Best Life Code, and I'm going to have a book coming out soon on GLP-1 called Doc, Should I Take Ozempic?
That's a credible title.
Good title. Yeah.
Well, Dr. Rudy, thank you very much for joining
My
us,
pleasure.
and
Guys,
really appreciate you taking out the time for us and
Really
and
enjoyed
sharing
this.
this is a big one.
Yeah,
This
yeah,
is
it's
an
good.
eye opener
Yeah.
for I think a lot of people, especially here in Saudi, but even around the world. It's going to be big. So thanks a lot for sharing all that.
My pleasure.
Till
Yes,
next
my
time.
pleasure,
Yep.
guys.
Thanks.